Hello, everybody. My name is Adalberto Martinez, and um, I'm here to discuss some of the interests and aspirations that I remember I had when I started taking this course. Um, I remember I took the test. I got about 86 on that test related to gerontology, related to um, the elderly population. Um, if I have to go back and try to remember what were the interests and aspirations to learn in this class, I remember I wrote about to increase the knowledge towards this population. Me as a nurse, definitely I work with elderly, and I really enjoy my profession. Um, However, I think that I always try to study this population more into diseases, more the disease process of what they experience, the symptoms, all the progress of the diseases, but never in a more um, overall and more kind of like seeing the big picture of not just seeing the patient but also how their family members might be affected, and also um, how financially many of the times they're not stable, and topics such as social security, healthcare, now that it has become so expensive. um, it has really This class has teach me so much in order to contribute and understand my patients better when I'm in the hospital working, and helping them out. Um, I learned also about um, the different cultures that we many times we assume, or we have not enough knowledge to approach different cultures, and what might for one culture might be normal, for the other it's not. It could be something misinterpreted and therefore make them feel uncomfortable. um, I also learned about um, I remember about euthanasia, and what is it what are what is my stand on that. And I really believe that um, the ultimate decision is the patient's decision. uh, they are the ones that they have to decide what is it that they want in their life. And of course, we as healthcare providers, we are there to help them, to um, assess them and make the right decisions, and be aware if um, an elderly or older individual is showing any signs of um, suicidal ideations. So it is very important for us to be aware of the factors that might contribute to this behavior, but also understanding that helping them to be informed and pick those details that many times it is very important for us to identify, to prevent any um, bad outcome. So I learned about, I wrote about that, um, the chronic diseases that they suffer. I learned about the theories of aging, which I had covered in previous nursing courses. Um, I What else I learned about? My experience at the Houghton um, Park facility. It was a great experience. Um, I really enjoy going and helping the elderly. I really identify myself to be able to um, work better with elderly people than myself, and I really would like to in the future to specialize and get into some gerontology field or something like that. So that is, I mean, I have so much more to share, but definitely those are my points that I decided to cover in this video. And thank you very much for your time. See you soon.